Breast cancer survivors, this video is a must-watch for you. When you are diagnosed with cancer, your entire world becomes getting to the point where you are free from cancer. And this is no small task. When you finally finish chemo, you think you're done. But then you are prescribed tamoxifen therapy for 5 years, 10 years, even indefinitely. Yikes. You probably thought that breast cancer treatment was going to be intense, but you likely didn't think that it was going to actually take this long. But here's the thing. This would all be okay if tamoxifen was actually easy to take, but it's not. The British Journal of Cancer found out that only about half of women actually end up taking their tamoxifen for 5 years. What? Only half? That is not very many. And the majority of women say that they stopped because of the side effects. Side effects like joint pain, hot flashes, mood swings, and weight gain, just to name a few. Pretty scary stuff, right? But here are 2 pieces of really good news. We know that tamoxifen will reduce your risk of a cancer recurrence. And as a cancer survivor, that's all we really want, is for our cancer to never come back. When I was going through cancer treatment, I know I would have done anything to make sure that I never, ever had to go through that ever again. So it's really appealing to have a medication that is known to reduce your risk of a cancer recurrence. And the second piece of really good news is that there is absolutely, without a doubt, 100% things that you can do to reduce or be completely free of the side effects of tamoxifen. That's exactly what I want to dive into here. You can have the best of both worlds. Take tamoxifen and reduce your risk of a cancer recurrence while being free from the side effects and feeling like yourself. Let me show you how. But first, let's back up because there's some really important things that you need to know about tamoxifen that your doctor probably hasn't told you. How exactly does tamoxifen work? You probably know that it's an anti-hormonal drug, meaning that it suppresses the estrogen in your body. But how? Tamoxifen actually blocks estrogen at its receptor. You see, in order for estrogen to have an effect on the body, it actually has to bind to a receptor in your body, kind of like a lock and key. Without the lock, you see, the key isn't going to really do much. But tamoxifen gets to the receptor or the lock and it sticks there. That actually prevents estrogen from binding and having any effect on the body. These cancer cells cannot grow or move forward without access to estrogen, so they just stop. When we think about estrogen, we typically only think about the ovaries, but there are estrogen receptors in other areas of your body too, like the endometrium, fat, and bones. Tamoxifen blocks estrogen in all of these places. But there's actually more. There's new science to show that tamoxifen may have anti-cancer effects beyond its work on the estrogen receptor. Tamoxifen may cause cancer cell death from other mechanisms that just aren't quite fully understood yet. Okay, so now that you know how tamoxifen works in the body, let's dive into the side effects that your doctor probably didn't tell you about and what to do about them. Let's start with the top 5 side effects that I see with cancer survivors that I work with, starting with weight gain. A lot of doctors dismiss that tamoxifen actually causes weight gain. Here's why. When the drug company reports how many women actually experience weight gain due to tamoxifen, they say it's around 8 to 9% of women. This is actually kind of ridiculous. In my clinical practice, I see that most women who take tamoxifen gain weight. The suppression of estrogen due to tamoxifen definitely results in weight gain, especially around the tummy or abdominal area. So if you found that you gained weight on tamoxifen, you are so not alone. The average weight gain of women is around 20 pounds. A 20-pound weight gain because of a drug that's designed to prevent cancer, that's a big problem. We know that gaining weight or being at an unhealthy body weight can actually increase your risk of a cancer recurrence. That literature is quite clear. So if a drug that's designed to reduce your risk of a cancer recurrence also results in weight gain that could potentially increase your risk of a cancer recurrence, then that's a problem. You've got to do something about it. So here is the first step to managing your body weight while on tamoxifen. You've got to focus on increasing your protein intake. Eating target levels of protein will help manage your weight while your estrogen is being suppressed by tamoxifen. With lower levels of estrogen, it's actually more difficult to maintain or lose weight. More difficult, but definitely definitely not impossible. What you want to do is actually support your body now that this drug is in your system. How we do that is to eat to your individual target protein levels. What happens is as estrogen decreases in your body, it becomes more difficult to maintain or gain lean muscle mass. And as you lose lean muscle mass, then your metabolism slows down. Even just sitting here watching this video, you would actually be burning fewer calories. So all of this leads to weight gain. How we counteract this is to eat more protein. This will support your body in maintaining or gaining lean muscle mass, therefore keeping your metabolism the same and your weight down. Start today by building more protein choices into your diet. Foods like chicken, tofu, cottage cheese, edamame beans, or eggs. Just build up your protein choices, which actually ties into the second side effect that you need to know about, hot flashes. It's generally acknowledged by doctors that tamoxifen does cause hot flashes. But here's what you probably have not been told. Almost all women have hot flashes on tamoxifen. This is especially frustrating if you are before menopause or you feel like you're too young to be experiencing hot flashes. When I was going through treatment, I would break out into a hot flash at the most inconvenient times. When I was doing my makeup or trying to get out the door in the morning or during an important work meeting. It was awful. The unfortunate part is that a lot of clinicians will actually state that only about 25% of women will have hot flashes. Before I was personally diagnosed with cancer, I said this to all of my patients too. You might get hot flashes, but it only happens to 25% of women. With a doctorate in cancer care, I was trained to read the scientific literature, and this is what it says. But it is not what is practically happening. In reality, it's actually about 80% of women. So if you're about to start tamoxifen or taking tamoxifen, then hot flashes are likely in your future. That's the bad news. But here's the good news. There are simple steps that you can take to reduce your hot flashes or be free of them altogether while still taking tamoxifen. The first step towards being hot flash free while on tamoxifen is to reduce your fight or flight response. We know that women that struggle with higher levels of anxiety or frustration actually end up having 3 times the number of hot flashes compared to other women. Now, reducing your fight or flight response is easier said than done, right? But I have a very simple and clear way for you to lower that response. Listen to relaxing music. By putting on relaxing music while you're at work or during your commute, or even when you're just around the house, you'll actually be reducing your fight or flight response and therefore reducing your hot flashes. 30 minutes a day minimum, start there. Okay, so speaking of anxiety or mood swings, let's talk about tamoxifen's biggest secret, depression. About 10% of women on tamoxifen will actually experience symptoms of depression. It's directly due to this drug and it can be quite severe. Now, going through cancer and chemo, that is no small task. You have been through a lot, and the anxiety and depression around this diagnosis can be a lot. So we want to acknowledge both the physical healing and the mental healing that is needed among cancer survivors. But having these symptoms and stressors just compounded by a drug that is supposed to be helping you, well, that is a tough pill to swallow. So here's what to do. Find cancer-specific mental health support. There's a lot of focus on the physical healing of cancer recovery. Of course, we all want to be cancer-free, but there's actually a lot more to it than just that. You not only want to be cancer-free, but you also want to be able to move forward and actually live your life on your own terms. No chemo side effects, no anxiety over a cancer recurrence, no scanxiety, no depression, no why did this happen to me? The only way through is to work through this cancer trauma. The definition of trauma is anything too fast or too soon. That's exactly what cancer is. It's like this high-speed train that whizzed by, snagged you up, and just took you along for the ride. You're functioning off adrenaline, scared for your life, just trying to keep your head above water, just trying to survive. That's a lot for anyone to go through. Mental health support is natural and normal and should be built into every single cancer recovery plan. What is especially important is actually finding someone who specializes in cancer care. You don't want to have to describe your diagnosis or chemo to your therapist. You want someone who's just gonna get it. You'll be able to move forward in your healing so much faster if you find someone who actually specializes in this area. So if you're depressed, anxious, or having mood swings, I want you to know that you're not alone. There are many cancer thrivers who are feeling the exact same way. And you should also know that tamoxifen can be contributing to these symptoms. That brings me to side effect number 4, muscle and joint pain. This is one of the most common reasons why women actually decide to stop taking their tamoxifen. The joint and muscle pain due to tamoxifen is often downplayed or even never mentioned by doctors. It can be severe and it can last either for a few months or the entire time you take tamoxifen. But it's actually more than just pain. Tamoxifen has a number of side effects on your bones. It can cause arthritis, osteoporosis, or bone loss. This is often why calcium supplements or foods containing high amounts of calcium are often suggested to women taking tamoxifen. Okay. But what are we gonna do about your muscle and joint pain? Because you can't live like this for 5 or 10 years. In pain every time you get up from a chair, from your desk, or get out of bed. That is no way to live. Here is the first step to be free from the joint pain. It's exercise. As a cancer survivor, being really targeted and strategic with the type of exercise you do can actually make it so that you're completely joint pain free. No more, gone. Here's how. There are a couple things to keep in mind. First, I want you to aim for low to moderate intensity cardio. Walking is a perfect option here. It doesn't need to be complicated or strenuous. Just tie up your running shoes and get walking. Goal is to aim for 10,000 steps or 150 minutes of low intensity cardio each week. But let's be real. Depending on where you are in your cancer recovery, this might sound really tough, like more than tough, maybe even almost unimaginable. We're not gonna get to 10,000 steps tomorrow, and that is okay. This is what we're actually working towards. Here is how you start. If you have a step tracker or iPhone, I actually want you to take a look at how many steps you're taking on average each day. Look at the last 7 days if you can. If you have an iPhone, just look at the health app. Your phone is actually already tracking your steps. You can just look back at the past 7 days and see what you actually did. If you don't have an iPhone or you don't track your steps, that's okay too. Just start tracking them today. Once you see how many steps you've been taking over the last 7 days, I actually want you to calculate your daily average. Just add up the number of steps each day and divide by 7. This will give you an average. Perfect. Now we know where we're starting from. Then for your first goal, I actually want you to add 500 steps to your average. In the coming week, that's actually gonna be your new goal. Just push what you're doing currently by 500 steps a day. That's how we slowly start building up your steps to hit that 10,000 steps per day and make it so your joint pain is completely and totally gone. A breast cancer survivor client I was working with was really struggling with crippling joint pain. She breezed through chemo. She didn't have a lot of side effects. She was able to still work and felt pretty good, all things considered. But then she started tamoxifen and the joint pain hit her hard. Couldn't really imagine living 10 years like this. She loved to run and be fit, but this joint pain was brutal. The first step we took was actually upping her exercise levels. We often feel like we should do less because of the joint pain, but you actually need to do more. It's kind of counterintuitive, but it works. We also used a combination of lifestyle changes, supplements, and dietary changes to get her completely and totally joint pain free. Amazing, right? Still on tamoxifen, but no side effects. There are actually a lot more things that you need to do to be completely joint pain free from tamoxifen. We need to work in targeted strength training, specific stretching, and actually stack your exercises. But just upping your steps is a brilliant place to start. That brings me to the next tamoxifen side effect that your doctor probably didn't tell you about: skin dryness. Hardly anyone mentions this, but tamoxifen can actually cause you to dry out. Dry skin, dry hair, and even a lot of women comment that their eyes get dry. This is absolutely attributed to tamoxifen, with about 20% of women experiencing this side effect. It's really uncomfortable, and then when you finally bring it up to your care team, no one thinks it's actually from the tamoxifen. Well, I'm telling you, what you're experiencing is actually very real. This is valid, and here's what you need to do about it. Drink more water. What is often overlooked in cancer recovery is actually hydration. Your chemo was mixed with hydration. Your chemo was often run alongside hydration. And sometimes as cancer patients, we might have even been brought back to the cancer clinic, just get hydration. That's a lot. And there's a reason why. Hydration solves a lot of problems. If you're already dehydrated, it can make a lot of chemo side effects even worse. The same holds true with tamoxifen. The way to combat dry skin is actually by drinking more water. But this is just the first step to supporting your body while on tamoxifen and preventing a cancer recurrence. If you're on tamoxifen, then you want to make sure your cancer does not come back. There are things you should and should not be doing with your food, exercise, and lifestyle to help reduce your risk of a cancer recurrence. Of course, you want to do everything you can to make sure you do not have to go through this again. That's exactly why I linked up this video here on 5 ways to reduce your risk of a cancer recurrence. This is life-saving stuff, so go watch it right now and I'll be sure to see you in there.